My name is Stephen Berretto. I'm a clinical psychologist employed at Bradley Hospital and also clinical assistant professor in the Brown Department of Psychiatry and Human Behavior. But I'm here tonight to talk to you as a psychologist, as a father of 2 children, as a husband and a resident of Rhode Island who was asked to take some time to review the literature on the well-being of children of same-sex parents, some of which you've heard characterized tonight, and to draft the Rhode Island Behavioral Health Coalition statement in support of marriage equality, which you have a copy of, a statement that's been endorsed by the Rhode Island Psychological Association. As a clinical supervisor and teacher, I try to think critically about what the principles of healthy development are, and I would give you 3 of them that I work with and teach. One is the qualities of parent-child relationships, and the second is the quality of the relationships among the significant others of parents in children's lives, and the third is economic and other resources available to children and families. So when you are considering this legislation, I would urge that you ask yourself the question, does the existing scientific literature support the idea that sexual orientation changes relationship quality? And you will find that the answer is clearly that it does not. Same-sex couples have been shown to have the same capacity for long-term commitment, and sexual orientation makes no difference in the capacity to care for or parent a child. That's why children of same-sex parents, when systematically compared with children of opposite-sex parents, do as well or better in areas of friendship, emotional development, and in the occurrence of behavioral problems, with the most recent of those studies meeting the highest standards of methodological rigor, which is something that was not commented on by at least one person who addressed you earlier on the topic. I would ask that you not be swayed by the claims of recent research study which somehow counters 30 years of social science research. This is the study by Mark Regnerus from the University of Texas that's been talked about today. To be fair, the study used a large sample population. It also used a novel and odd and controversial classification system. And in the testimony that I submitted to you today are more details that I'm not going to go into tonight or this morning because it's so early. But I will quote you the American Sociological Association's critique of that study because it counters what you've heard tonight, and it appeared in an amicus brief. Quote, all told, the Regnerus study, even as revised, does not undermine the consensus that children raised by same-sex parents fare just as well as those raised by opposite-sex parents. In fact, the study really compares apples and oranges. The American Psychological Association, the National Association of Social Workers, the American Psychiatric Association, and most recently, the American Academy of Pediatrics, have all reached a consensus, all emphasizing the point that sexual orientation has no impact on the ability to engage in stable relationships or effective parenting. We now have over 1,000 children studied of same-sex parents, many of them assessed by using standard measures of behavioral health and psychological adjustment. And you know what? The kids in those studies are doing just fine. So I urge you to review the materials that we've submitted to you as you make your deliberations, and they include a lengthy reference list, and I'd be happy to answer any questions about that or the Regnerus study as I understand it.
Thank you very much for your testimony. Does anybody have any questions?